We are here in Shechen Clinic. Shechen Clinic is part of Shechen Monastery. It's a charitable medical clinic who sees 40,000 patients per year. A great part of these patients receive everything for free. And it has been inaugurated in October 2000 and has been expanding ever since. Shechen Clinic is taking care of absolutely everybody in need of care. We don't care about political, religious, social, caste, belongings. The only thing is people need help, they are welcome here. A unique features of Shechen Clinic is that it harbors different kind of medicines, classic medicines, allopathic medicine, and also alternative medicines in like homeopathic and Tibetan medicines. And normally most of the patients start with going to see the general practitioner, but these three services work together, which means that sometimes they are then dispatched to the homeopath or to the Tibetan doctor. For example, liver problems have fabulous results with Tibetan medicine. Skin problems have very good results with homeopathic medicine. And on the other end, when people have very bad infections, high fever and so on, then it's the homeopath or the Tibetan who are sending them to the general practitioner. It makes the whole thing very safe and it allows people to get the best of the three kinds of medicines. Shechen Clinic is having a staff which is a local staff composed of Nepali, Tibetan and Bhutanese people. But we also have volunteers coming, Western volunteers coming to offer their services to the clinic.
So we are an international dentist team. Some of them are from Switzerland and we are from France. And we came at the Shechen Clinic because we wanted to do some charity work after our studies. So the collaboration with the people working at the clinic is very efficient. And even for people like us who only comes working for a few weeks, we can do very good work and we can help people.
The Service of Reproductive Health, Dr. Kunsang Sherpa, is doing everything. That means she's talking with people, she's counseling, she's taking care of infectious disease, she's taking care of contraception. She's also advising in case of domestic violence. There is a tremendous amount of domestic violence, which is most of the time related to alcoholism. So all these things she's doing, it means that people coming to that service are really seen for a long time. They can talk and exchange about their problems and so on. This clinic has been really designed in order to be very welcoming for poor people who are generally scared of hospitals and so on. And most of the poor people are illiterate, so we really insist very much on being very kind with them, and also like they cannot read a prescription, so the prescription is explained to them. The nurse who is in the pharmacy is getting them to repeat it, so we are sure that they will follow the prescription. We never give medicine for a long period. They have to come back, so we're sure they follow everything the doctor has said to them. And in this part of the clinic, which is the hospice, we're really trying with poor people who are at the end of their life to give them a lot of affection, a lot of human care and so on. And we have seen since we opened the hospice that it's probably helping them much more than any medicine can do for the end of life. Nepal is a very troubled country, and there has been, the political situation has not been clear since 10 years, which has kept the people being more and more poor. The level of hygiene is absolutely appalling, and we have had riots the whole month of April. It was reported in the international press. We managed to be open all the time, in spite of the fact that some staffs who have to come from Kathmandu, from the city, could not come because the roads were blocked. And because of all these troubles, a lot of people have been leaving their villages in the mountains and come to Kathmandu, where they are in the street and getting poorer and poorer, which is significantly increasing the quantity of destitute patients we are seeing in the clinic. The lack of hygiene, of medical care, and the lack of instruction are causing a lot of terrifying problems, like the increase of HIV/AIDS patients, but mainly, more even than HIV/AIDS, the hepatitis B. People have no idea what an hepatitis B has, and it has become endemic here. There is I think we can talk about an epidemic of hepatitis B, and we see very young people dying because their liver is crashing down.